Hi rehabbers, it's Kevin from the Rehab Revolution YouTube channel, and this week's learning will be how to assess the hand intrinsics in 5 minutes or less and give some basic exercises. So the first part of the video is on how to assess your hand intrinsics. In particular, we'll be looking at the Interossei muscles, so Palmar and Dorsal, and we're also looking at the Lumbricals. So if we start with the Lumbricals, so they come from the flexor digitorum profundus, which comes up here, and it comes around and attaches to the radial side of the extensor tendon / extensor hood. Their job is to assist in flexion of the MCPs and extension of the IP. So that is position of the lumbricals. Now the interossei, so we start with the palmar, and they go from the border of the corresponding or the relevant metacarpal, and they're going into the base of the phalanx, and also some attachments can be found in the extensor area. Now their job, so for the palm side, remember PAD, P-A-D, so palmar adduction. So adduction means movement of the finger towards the middle finger, so it can be this one to here or this one to here, whereas the dorsal, D-A-B, dab, the dorsal abduction, so I'm moving away from the finger. So you can see there, so this one is moving that way, this one is moving this way. So that's very quick rolls that they do. Now to test, obviously, you can do for dab, so dorsal abduction, you can do abduction of the finger away from the middle finger. So there, and you can just do an isometric hold. And then the reverse is true. So for the palmar, so pad, they adduct. So again, if I put you here so you can see, I'm trying to move that way and we're blocking it. And then for the actual lumbricals, you can put them into this position, so the emu, and you are trying to break their flexion. So you are putting resistance up and you want them to stop it. So you're going that way here and you're resisting it. So that's a quick way of assessing the palmar and dorsal interossei and the lumbricals. Now you can also test for stiffness. So in this position, you have to put them into maximum extension and then check how much flexion they have at the pip. Now, if you find that there is less flexion up here in extension, but in flexion it's full, so can you see that? Then that means there is tightness of the intrinsics, and we can start to work on those as needed. For strengthening the basics, we can do ab and adduction, but keeping the fingers on the bed, don't let them go. We can use putty, and we can even put more than one piece in, and we can adduct in. We can use bands. So in this position, adduct towards the middle finger, or on this one, so abduct. So we're doing this one, abduct, away. And for the other exercise for the first interossei can be in this position and lifting the little finger. There's a nice one. Starting for the lumbricals, you can do the tent. So if you see there. And then manual treatment for tightness. So put them into end of range, and when they are in end of range, so they're really far back, you can then start to do manual treatment. If you haven't got them into full extension, obviously you're not really doing anything. So you put them in as far as you can, and then you can mobilize. So this was a very quick video on how to assess and give basic treatment for dysfunction of the hand intrinsic muscles. If you've liked the video, please like, share, subscribe, and I'll see you in the next video.